I am happy to be here today to really discuss what we're doing here in St. Louis County, how we got to this point and our path moving forward. I serve as the Director of the Office of Family and Community Services for St. Louis County Government. We are the collaborative applicant for the St. Louis County CoC. So just as a level set, I wanted to utilize this slide to really give an understanding about what is equity. We could talk about racial equity, we can talk about any number of equitable matters, but it really focuses on outlining vulnerability and addressing that vulnerability. And so where needs and resources are expressed, a need for, then that is where you should dedicate those resources. And so equity has always been in our framework, and I'll highlight this on our next slide as to why. St. Louis has a really interesting history that is rife with segregation and a number of challenges. And so to that end, we have a lot of information from which to pull that outlines exactly some of those challenges. And so over the last many years, especially since the death of Michael Brown in 2004, the events of Ferguson brought in the DOJ that really took an analysis and understood what were some of the issues that were plaguing us here in St. Louis. We also here in St. Louis are the city where the Dred Scott case was heard, and there have been several papers that have outlined the issues of segregation, discrimination, and disparities that exist as a result. This systemic challenge for our community is highlighted in a social science research tank here in St. Louis at the University, the Washington University, at the Brown School of Social Work. And they did a few studies. One was called For the Sake of All, which is a report really looking at the health and well-being of African Americans. That was done in 2015, done by a friend of Jason Purnell. His work is nationally known. Secondly, there is a street called Delmar here in St. Louis, which really serves as a physical almost barrier and symbol of segregation here in St. Louis. Although it's located in St. Louis City, the segregation does not end at the city line. St. Louis County has a fair share of segregation, and the outcomes that result from such systems are really challenging. We also look at a number of cases, historical on up to this date, that were outlined in Richard Rothstein's The Color of the Law, and that was published in 2017 and helps to serve for context around some of the challenges here in St. Louis. So why does it all matter? We're talking about homelessness, we're talking about HUD, but really we're talking about people's lives and their well-being. And so we understand this work not just simply from HUD dollars, not simply just from housing individuals, but ultimately taking care of the comprehensive needs of households. And so we focus our efforts and our research around the social determinants of health. We focus our partnerships and the build out of our CoC and other relationships in the same fashion. After the death of Michael Brown, the governor appointed a Ferguson commission, and that commission over quite some time developed a report that not only outlined some of the challenges here in St. Louis, but also provided recommendations and action steps that our community needed to take to make a difference. Again, I talked about the For the Sake of All study before. Also here in St. Louis County back in 2018, the CoC was really interested in understanding the outcomes for those based upon race that were coming through our homeless service system. And through that analysis that I'll get to on the next slide, it really outlines some really important matters. The affordable, go back one slide, sorry. We also recognize that the segregation in St. Louis didn't happen by accident, and it wasn't going to change without some intentional efforts. So there was a task force put together in 2018 to explore the need and the way in which an affordable housing trust fund could be established in St. Louis County. Happily, in 2019, an affordable housing trust fund was established, and it's also within our Department of Human Services. And in 2020, in the middle of the pandemic, we were still able to, subject to that affordable housing trust fund being passed, we came together to develop our St. Louis County Housing Strategic Plan, which outlined all of the resources from HUD, local, and other affordable housing dollars and community partnerships that give us direction around how we put these dollars together for collective impact. Next slide. Specifically speaking to the COC's analysis back in 2018 and trying to understand the racial equity challenges that might exist within our homeless service system, we looked at the assessment tool that was being used, and that was the VI-SPDAT. And we looked at the acuity scores associated with each race. And as you see, the highlighted area there, unfortunately, African Americans were noted as having the lowest acuity score of all individuals, for the most part, that were coming through the homeless service system. African Americans disproportionately make up the homeless population across the country, as well as that is the case here in St. Louis. St. Louis County residents are comprised of approximately 25 to 30% African Americans, and however, African Americans make up over 70% of the homeless population. So why does an acuity score even matter? Well, ultimately, those acuity scores were used to determine what is the most appropriate housing option for a given household. And so if your acuity score is deemed to be lower than it actually is, then your opportunity for long-term supported housing is also hampered. And so that's essentially what we saw as well. African Americans, although they make up a huge percentage of the homeless population and have significant challenges subject to historic and systematic racism in this region, we're only being offered 35% of the time an option of permanent supportive housing. To the converse, their Caucasian counterparts, more than half will be receiving that as an option for housing placement. A year later, C4 Innovations did a study and looked at the VI-SPDAT's use across the country, and were able to essentially validate what we had noted a year prior. Minorities received lower acuity scores. White individuals were prioritized for PSH at a higher rate. Race, seemingly, unfortunately, was a predictor of receiving a higher score, and that the VI-SPDAT wasn't terribly good at identifying true vulnerability amongst the minority population. And so why did all of that matter? So it sets the context for our understanding, our lens, our focus of how we move forward in our priorities in addressing not only our homeless population prior to the pandemic, but ultimately during this pandemic and beyond. And so our major priorities have always been centered around, particularly during this pandemic, education. And that education goes to first an understanding about the virus itself. I liken the beginning of the pandemic to what was being experienced in the 1980s when HIV was having some real impacts on various communities, particularly on the West Coast, and the hysteria that resulted. So making sure that everyone was level set, both clients, individuals we serve, as well as operators of systems that we interface with, providing them the appropriate supplies so that they could keep themselves safe, et cetera. We knew that stay-at-home orders were almost oxymoronic when the definition of the population that we commonly serve is that they're homeless. And so where is home? So we knew we had to increase shelter capacity And to that end, we increased our shelter capacity at a minimum by 20% during the beginning of the pandemic to account for any additional needs that might be expressed. Those additional shelter beds, as well as the existing ones, were inclusive of social distancing recommendations. We established a quarantine and isolation center. St. Louis County is the largest population of a county in the state of Missouri. We represent about 16% of the state's population, but only about 8% of the state's homeless population. I'd like to think that's because it has a number of employment and other engines that assist us in balancing that. But we also understand that there are just challenges within our region. We have another county to the west called St. Charles, county to the east, that's St. Louis City, and then just across the river is Illinois. And so we're in an area where regional thought and connection really matters. And so our partnerships had to be comprehensive. Our hospital systems operate in all of these different jurisdictions as well, and we needed to make sure that we were supportive of that. And so to that end, approximately 4 years ago, there was a body in which I'm the co-chair, which is the St. Louis Area Regional Commission on Homelessness. And that is a body of over 6 continua of care throughout the St. Louis metropolitan area, both in Illinois and Missouri, that come together to address the needs of homelessness. And that is coordinating that effort. And so during this time, that served as a great platform and arena for addressing some of these critical matters handled during the pandemic. Vaccinations certainly are critical, and it is an ongoing battle, as we know that supply is much more readily available now, but hesitancy still is existent. And so these are some of the challenges that we continue to work through in partnership with the health department as well. But I would also say equity doesn't stop, and it doesn't start with these emergencies. We're in a pandemic, but equity is something that lives on, and we'll have to really be focused in on in some of our next slides around this issue of homeless prevention. First, I'll just talk a little bit again about quarantine and isolation. We provided a regional footprint to our quarantine and isolation, taking direct referrals from health institutions, hospitals, community health centers, et cetera. The reason we got those direct referrals from those systems was to ensure that we did not miss anyone. The most vulnerable in our communities often use the emergency room as an option to seek refuge, also to get critical care because they don't have primary care in place. And so those are the places where we're often finding the most immunocompromised, those who are most disparately impacted, and those who are deemed as chronically homeless. And so that was a great avenue to ensure that we caught people immediately before they left the hospital and potentially exposed someone else. That regional footprint meant that we were the only operator of quarantine and isolation in the St. Louis region. And we would take those referrals from those other continua of care. Great partners in their health departments, as well as we coordinated with them with the contact tracing, and also making sure that we had on-site management there that could attend to the everyday needs of those there on site. Providing meals, case management was a key element, as after that 10 or the 14-day period of stay, we needed to make sure that they were placed in some sort of housing situation. And so that was critical. So we developed relationships all throughout the way to ensure that the comprehensive needs were addressed. This gives a little bit of data around our quarantine and isolation operation. Over 300 households were assisted during this time. This not only included singles, but also families, and there were over 2,200 days of isolation quarantine that were provided to those households. 86% exited to permanent housing destinations. And so that is a critical element. A very small percentage left on their own. Certainly remaining in isolation or quarantine for a 10 or 14-day period of time is not easy for anyone. I think we all can understand that as an experience. But it is probably even more challenging if the party has behavioral health needs and or substance abuse needs. And so we worked very closely with our behavioral health, our hospital systems, to ensure that we closely monitored individuals who had those additional vulnerabilities. And that was, again, part of our focus around equity as well, to address the needs of the most vulnerable. What we didn't want is for those who exited prior to clearance from the health department that their isolation had been concluded. We did not want those individuals to leave and then re-enter into shelter. So we worked with our HMIS provider so that if anyone left prematurely, they were immediately flagged in the system and could not enter into another shelter to cause any sort of outbreak. Again, equity goes beyond the immediate. It goes into the framework of how we preclude ourselves from falling into outright increases in homelessness going forward. And so we have the ERAP dollars, we've had the CARES dollars, and there are additional dollars that are coming forth very soon. And to the end that we are thinking about equity under the pandemic, we need to be focused in an equitable manner moving forward. And so what we wanted to do is, again, make sure that we had the tools in place to help support while we're focusing in the way that we are. What we do know is that there's an unequal distribution of risk factors for various communities, particularly those, again, who are most vulnerable. And that includes issues around access to health care and inability to work from home. We know that many of these communities also have a very, very difficult time paying for rent or mortgage if they have a mortgage. There are also issues around social distancing. We have homes in which there is overcrowding. There are multi-generational homes just to try to make ends meet. And so there are some challenges there. We know that also in some of these communities where renovations haven't been made, there is environmental racism factors that are in place that also make respiratory illness higher in those communities as well. And so we can't neglect to understand the issues of structural racism when it comes to these factors. So we work with Washington University Brown School. We just so happened to have one of the assistant professors there working in the county executive's office as a senior policy advisor. And so we were having some discussions to make sure that we had an appropriate assessment tool that can give us an indication of how we should direct our resources. And to that end, this tool was developed. We call it the Health and Economic Risk Index, otherwise known as the HERI 10. There are 10 variables that are used, and we'll talk about those in just a moment. But ultimately, it is to support individuals and communities so that we could slow the spread of COVID-19. Extraordinarily important, both for those who are unhoused and also how do we mitigate that for those who are at risk of losing their property. So there's really two different arenas. There's the health risk variables that have 5, which are listed here. And it's really looking at the asthma rate. Again, COVID-19 had a significant impact and has a significant impact on those who already have respiratory issues. And that can be one of the most significant consequences of the disease. And so those who also have COPD, all of those are issues that compromise a person's ability to sustain themselves and get through potential exposure. as well as diabetes emissions and premature death rates. Then there are the economic risks, and these variables are listed, and they focus again on poverty rate, particularly for those who have families, those who are unemployed, those who are in high-risk labor markets, and then those who are in neighborhoods where the percentage of white owner-occupied housing units are a factor. Again, St. Louis has a high degree of segregation, and so these are some of the elements that on our next slide will show you why that matters. So each one of these dots here represent a zip code in St. Louis County, okay? So we're really looking at geography. As you look at the x-axis, we're looking at economic risk. Looking at the y-axis, you're looking at health risks. So as economic risks increase, so do health risks, very closely and strongly correlated. And those are also very closely correlated because of the segregation here in St. Louis. So those zip codes really closely align with that factor. So these are real things that we had to consider when we were thinking about how our resources were deployed. So out of the HARRY 10 scores, this is how it plays itself out. Those areas that you notice in the northern and eastern edges of St. Louis County have the highest scores. So vulnerability is significant in those areas. These are the most at-risk communities when it comes to poverty rate, disproportionate impacts of COVID-19. Also have some of the lowest vaccination uptake as well at this present time. If you notice on this map, it's slightly different, but the actual areas are very much the same. So pink, the darker color ones, are really showing you that homelessness also closely aligns with the HARRY 10 index as well. And so, again, all of these things really marry themselves. This one actually also includes some data from St. Louis City, which is on the eastern edge just before the river in the middle of this slide. But these are some real challenges, and so we wanted to utilize this to kind of show you how these things are all related. And so to that end, we use the HARRY 10 to help inform how we move forward with our CARES Act dollars. And so St. Louis County was a direct recipient as a result of having more than 500,000 people as a county, received $173 million, spent $20 million on a humanitarian fund to start with. I think it actually went north of that as of now as some reallocation of funds has occurred. But ultimately, housing and utility assistance had approximately $7 million of that $20 million. That fund was facilitated and disseminated by 24 nonprofit organizations in the community who assisted many households, thousands of households. We actually had over 5,000 applicants. The assistance was outlined and framed in a way that, again, focused on the most vulnerable. Under the General CARES Act dollars, a community could use its own decided upon income guidelines. We chose to ensure that it was going to the most in need, and so our 80% of AMI was put in place for this fund. It also made sense because at the time, the ERAP fund wasn't thought of. There was no legislation to support that, and so we were in the assumption that the CARES Act dollars had to be spent by December, and what other resources would be available to carry on what we knew would continue to be a need in the community other than some of our CDBG dollars and ESG dollars. And so we wanted to make sure those who weren't potentially assisted or needed ongoing assistance didn't have an issue because income guidelines were different. Average assistance for the households who received funding was a little shy of $2,000. What we always want to do is make sure that when we're putting together programs and we're executing on them with our partners in the community is that we don't miss anything. And that really requires an openness and relationships that allow for folks to tell you the truth. And so we surveyed the organizations in the community about what was working well and what wasn't. And they told us a little something about what they thought of the CARES Act funding source under the Housing and Utility Assistance Program. They indicated that they would have liked it to have been a more streamlined process. That was feedback that came from organizations as well as from those who were seeking the assistance. Having to navigate multiple channels and possibly some confusion around that was certainly a concern. They wanted a minimum documentation. Now, certainly that becomes an issue with many federal programs, and some things we can't avoid in that manner. They wanted to make sure that the process was standardized across the board, and reporting was in line with that as well, making sure that we were open to all communities, undocumented and those who are non-English speaking, and making sure that there were, most importantly, more resources. And so, out of that feedback, the emergency rental assistance then presented itself. St. Louis County was one of the 7 communities in the state of Missouri that opted in as they were eligible, because they have more than 200,000 residents, were eligible to administer those dollars locally. There was one county of the total 8 that had the ability to opt in that chose not to. And so initially in working with the state, there was going to be a significant difference in the amount of resources that would potentially be accessible to St. Louis County and other counties who were able to opt in. And so St. Louis County, again, makes up 16% of the population, yet our ERAP fund to be directly administered was a little shy of $30 million. As a proportion of the state, our residents should have had access to a minimum $65 million. And so we had some conversations with the state of Missouri about the equity issue here as well. Many of our more urban, more populous communities were the most impacted by COVID-19. Also have some of the most impoverished groups, and also have some of the higher cost of living. And so we were thankful that the state was agreeable to that and have opened that funding source for access by all opt-in communities. So this is what we really focused on. There were a number of folks who, under the CARES Act, who applied due to the exhaustion of that initial $7 million, had not yet been assisted or needed additional assistance. So under the ERAP program, making sure that those folks were taken care of. Again, the income criteria remained the same. Much of the eligibility criteria that we had outlined in that initial CARES Act aligned with the emergency rental assistance program, so it made it a lot more seamless in transferring of those individuals. We also wanted to focus on those who were imminent risk, and that's why we partnered in a variety of ways, one of which, a critical element, is with the court system. Each jurisdiction and locale has its own sort of moratorium, notwithstanding what's happening with the CDC. And so to that end, it was critical for us to first understand who was directly being impacted. And if I were to go back to all of those maps that I showed earlier, the eviction numbers marry those same highly impacted communities. And so to that end, we wanted to ensure that information about the emergency rental assistance program was able to be gotten to all parties that might be impacted. And so on all summons that go out for a potential eviction, those parties receive information about the emergency rental program as well as ways in which they can apply. The critical element of this emergency rental assistance program versus prior iteration is that we took into account the feedback that the community told us about. And they said we wanted a centralized, seamless process, and that's exactly what we've done. We've utilized a centralized application. That application has a two-way feedback in which applicants can determine where they are in the process. Landlords are able to apply on behalf of the tenant as well. And so this creates a greater opportunity for these resources to reach more households. But one thing we could not miss was ensuring that we had local partnership to provide case management and also assistance with the most vulnerable communities. Again, back to equity. Another key element is centered around utility assistance. We have a number of other programs that are operating annually, LIHEAP being one of those programs, et cetera. And so we wanted to ensure that there was no duplication of not only benefit, but making sure that as much money for rental assistance could go to certain households that they did. And then secondarily, that we didn't leave other resources on the table that would go unspent because of our failure to coordinate and plan together. So that was another key element. Working with workforce development, since many of the households have lost income, ensuring that they're connected to opportunities to regain that income is critical. I would say this is probably the last point is really, really important, and that's in working with the courts, working with many of our legal advocates in the community. We recognize that there was a need to do direct door-to-door outreach. And the reason being is that although the moratorium on the evictions was in place, that did not stop eviction court proceedings from occurring. So there are cases that were being adjudicated, but just not fully executed by a sheriff for that eviction. And to that end, as soon as the moratorium was up, folks were going to be evicted. And so a few weeks ago, many partnering nonprofits, grassroots organizations went out and did door-to-door engagement of households who were in risk to ensure that they were aware of the CDC declaration as well as the assistance that could be provided. I just wanted to give everyone an opportunity to link on the next slide to some of the additional resources that give a little bit of background around the framing and our thought pattern around how we address and tackle this issue within our community. These reports are really important, the first three. I guess the last is really more a shameless plug about the St. Louis County CoC. But the first three give, I think, a really in-depth view of some of the challenges that a community like St. Louis might face, a city like Detroit might face, a city like Los Angeles or Oklahoma City might face. Every one of our communities have some level of inequity that exists, and it's incumbent upon us to make sure that we get our eyes checked when we put on our proper lens when focusing on moving forward with this work. Again, that's my contact information, and I am open for any questions.